Good morning to one and all present here who have joined today for this online awareness campaign on digital eye strain and COVID-19. Firstly, I would like to say thanks to our college principal, Dr. D. Gladys, and principal in charge today, Dr. Latafan Madam, Bharati Women's College, Chennai, to given me this very good opportunity to conduct me this event. And also I thank to our Director, Youth Red Cross India, to given this support. I welcome all distinguished invitees who are all accepted our invitation and present here. It's a very pleasure to start this auspicious occasion by healthy welcoming everyone. My special welcome to our special guest speakers, Dr. J. Sinduja and Dr. Roshan Kumar, for today's online awareness campaign on digital eye strain and COVID, who is going to deliver their effective speech to meet our present scenario with our facilities available in front. I am asking to Mrs. Grace to introduce our guest speakers and their academic travel till date. Over to Grace.
I'm so honored and so excited in welcoming and introducing Dr. Sinduja J, who has completed her MBBS at MMC in 2007, then her PG in ophthalmology from Regional Institute of Ophthalmology, Chennai in 2010, DND ophthalmology at Rajan Eye Care in 2013, consultant ophthalmology at Vishnu Eye Care since 2014, and Sai Eye Clinic from 2020. Once again, I welcome you and hand this session to you for a vibrant insight from you, ma'am. I welcome you. And once again, I'm so glad to have you here to have your insight on our eyesight.
Can you see my screen now?
Yes, ma'am.
Okay, fine. So, good afternoon, one and all present. I am Dr. J. Sinduja, consultant ophthalmologist. Before starting, I would like to thank Sun Pharma and Dr. P. Sujata from Bharati Women's College for having given this opportunity and platform to talk about digital eye strain. So, let's go ahead with the presentation. So before just starting the presentation, I would like to ask a few questions to whoever is attending. First of all, let us find out whether you have digital eye strain. So answer the question, do I have digital eye strain? Do you feel any of the following symptoms while using your digital device, like eye tiredness, headache, blurred vision either for distance or for near, irritation of the eyes, neck or shoulder pain? If the answer is yes, then you are suffering from digital eye strain, or previously called as computer vision syndrome. Now, the question arises, why are we talking about this? Why now? Why this? Why are we so concerned about digital eye strain now? Because of online classes. Earlier, from 1995, when there came a computer boom, it was only adults who were using computers and laptops. But with the onset of COVID, what has happened is even children are being forced to stay indoors and attend online classes. So the amount of digital usage has increased. So let us know something about digital eye strain. It was previously called as computer vision syndrome. It's basically a physical discomfort or tiredness of the eyes after 2 or more hours in front of digital screen. You'll be surprised to know that any person who is exposed to the computers or digital screen, your iPads, your laptops, your cell phones for more than 2 hours a day is bound to have an eye strain. So what are the common symptoms of a digital eye strain? You can have anything ranging from mild redness or to as severe as headache. So it could present with redness, irritation of the eyes, grittiness is what is called as dry eyes, grittiness of the eyes, blurred vision both for distance and for near, general fatigue of the eyes. Fatigue is eyes getting tired. So how do you feel? You keep your eyes closed, you will start feeling better. That is when your eyes are getting tired, you'll feel that way. Back and neck pain, and then headache. So these are the common symptoms of digital eye strain. So let us now find out why this happens. It can happen because of your poor ambient light, glare from your digital screen, improper viewing distances, uncorrected vision problems, poor seating posture, and effects of excess exposure to blue lights. So now we know what causes it. We will try to find out what is the solution for it. So these are the tips to relieve digital eye strain, or reduce, in other words. The first step is get a comprehensive eye examination. Why should this be done? When you are in a classroom, you're viewing at a distance board, small powers will not be a big issue. But when you're looking at digital screen, brightness, contrast, and there are a lot of things that play a role, and even a mild power can cause you eye discomfort. So get a comprehensive eye examination, and if there are mild powers, start wearing glasses if required. Then use proper lighting. When you use a computer, your ambient light, that is surrounding light, should be appropriate. If possible, position your computer monitor or screen so your windows, the windows in the house, are to the side and not in front or behind it. See, this is the ideal way a computer or laptop should be placed. The screen should be 90 degrees to the window. The window should not be behind or in front of it. If the window is in front of the monitor, you will have glare from the window. If it is behind it, the backlight will scatter and cause you disturbance. So place it 90 degrees to the windows. So to minimize glare, what else can you do? You can put shades, curtains or shades if the light is too bright inside the room, and or else you can start wearing anti-reflective glasses. If you are a person who is wearing glasses for a refractive error, you can use anti-reflective coating along with it. And you can also, there are separate anti-glare screens available for monitors. So the second one in this is the anti-glare. There are a lot of coatings. The second one here is the anti-glare, which will help in reducing the reflections. A lot of laptops and computers now say that our screen itself has anti-glare property. How do you identify whether it has an anti-glare property? So one screen is divided into half. After you switch off your laptop, when you look at a switched off laptop, if you can see your face clearly as in the left end, that is called as the glossy finish. If you cannot see your face, it is called as the matte finish. What they say is matte finish has some amount of anti-glare property. So for children, it is better to go in for matte finish laptops, which inherently has anti-glare property. So adjust your device display settings. So brightness should be approximately same as the surrounding workstation. So how do you do that? As I told you, brightness should be approximately same as a surrounding, your ambient lighting. No, so how do you do it? Take a white paper, compare it with the lighting in your surrounding, put it near your computer screen, and then adjust your computer screen brightness according to it. In the left end, the computer screen is more brighter than your paper, but in the right end, it has been adjusted. The brightness has been adjusted. So if you bring down your brightness to your ambient light, then your eye strain comes down. Then adjust the text size and contrast. If you are comfortable with big text size, please go for big text size. And as far as contrast is concerned, black print on a white background is supposed to be best. Avoid low contrast text and low contrast backgrounds. Don't use busy backgrounds. The one in the last, brown that has some pattern in it, that is called as busy background. Please do not use such things. They may cause eye strain on a longer run. Then adjust your device color temperature. This is pretty, what is the color temperature? Basically, the amount of color saturation is given as color temperature in monitors, basically. So we have three pictures of the same thing. The one in the center is the ideal one. The one in the center is the ideal one, which is around 6,500 kelvins. Most of your laptops, desktops, LEDs all have 6,500 kelvins of color temperature. The one in the left end has a higher color temperature, which is around 7,500, and one on the right end has about 4,000 kelvins. So what they say is during daytime, you can have the middle one, the normal one. And when it is night, when you're working in the night for a longer time, please go in for the one in the right end, around 4,000 Kelvin, so that your eye strain is reduced. What is the difference is basically the wavelength. In 6,500, there is more of blue light that is emitted. In the VIB-GR, the violet, indigo, blue, right? So that range is emitted more. So usually blue wavelength kind of strain the eye. So when you're working in the night, please opt for lower color temperatures, which can be adjusted manually in your laptops and desktops. You have to go to the display setting and make the change. If you're not able to go ahead with all these things and remembering, you can have blue blocking lenses, which will block out your violet and the blue spectrum of the GR, and then you'll start feeling comfortable. And second thing is blink more often. So why should I blink more often? See, a normal blink rate of a person is around 17 to 19 blinks per minute. But if you start working, if you start reading and concentrating on something, your blink rate automatically comes down by 1/3 of it. Okay. So blink is something like a windshield wiper. The wiper on your car, it is like that. The tear that is produced in one end of the eye is spread throughout the eye by only the blink. So when you forget to blink, your eye, especially your black part of the eye, tends to dry, and this will start giving redness, irritation, and all your dryness symptoms. So that is the reason. So if you can consciously train yourself to blink, it would be an added advantage. Or else during your breaks, make sure you blink. So blinking more often kind of like relieves you from digital eye strain. Or the second step is you can go in for lubricants, which are external supplements. You use lubricating eye drops, so to relieve eye strain. Then you can exercise your eye by what is called as this 20-20-20 rule. So what is this 20-20-20? When you're working on a computer, every 20 minutes once, look away from your computer at a distance object that is 20 feet away. Okay, for at least 20 seconds. So it is a 20-20-20 rule. So why are you doing this? Basically, your computer falls within 18 to 24 inches from your eye, and you're converging both the eyes. You're bringing both the eyes together to look at the computer. A long time convergence activity can also give eye strain. So to relieve that, we are asking you to look at something distance so that your eye strain is relieved. So follow the 20-20-20 rule. So this is what it is. It shows here the person is working on computer which is near to him. Then we are asking him to look at something far away. So every 20 minutes once, look at something that's 20 feet far away for 20 seconds. Then take frequent breaks to reduce your risk for computer vision syndrome and the neck, back, and shoulder pain. You have to start taking frequent breaks. During computer breaks, stand up, move around, stretch your arms, legs, neck, shoulder to reduce tension and muscle fatigue. And please do not look at your mobile during breaks. This is actually a request because your mobile is once again a digital screen, and it is no use of taking a break and looking at your mobile phone. Modify your workstation. What is an ideal workstation? So this is the correct sitting posture. Your monitor should be 18 to 24 inches from your eye. It should be at the level of your eye or slightly lower than your eye. If it is little lower than your eye, your lid will cover your cornea for about 2 mm, and that gives a protective effect. Don't place it above your eye level. And then your arms, your legs, and your feet should be parallel to the floor. Your back should be straight. And every 20-25 minutes, take a break. Okay? And do not sit in front of blowing fans and ACs, because when there is air speed, there is going to be more evaporation and your eyes are going to dry faster. Last, don't you overuse digital devices. Restrict your timing. There is something that we can condition ourselves to. Do not overuse digital devices. This is an American Academy of Pediatrics and WHO guidelines for screen time based on age. What they say, according to them, till 1.5 years, 18 months is 1.5 years, no screen time. Video chatting alone can be done, but no screen time till that. From 18 months, 1.5 years to 2 years, little or no screen time is recommended. You can watch it with, you can co-watch high quality, only educational content. 3 to 5 years, only 1 hour per day. 6 to 10 years, maximum 1.5 hours per day, and 11 to 13 years, 2 hours per day. So this is all not being followed today because of classes being held, which I think will get over by December. So after that, children are going to go back to school. So even after they go to school, please do remember this is the ideal time according to the age group. This is how much they are supposed to see. So the take-home message is basically have a complete eye examination, follow the 20-20-20 rule, blink often and try to make it a practice. Glasses and lubricants wherever required. Modify your workstation and do not overuse digital devices. Thank you.
Thank you, ma'am. Thank you once again. The session was delightfully vibrant.
Thank you. Yeah, thank you.
And it indeed gave a new viewpoint to us all. Once again, I thank you for this session.
Okay,
and
thank you, Grace.
Thank you, ma'am. Now I'm so happy in welcoming and introducing Dr. M. Roshan Kumar, who has completed MBBS at SRM Medical College and Research Center SRM University, and then his MD in Pulmonary Medicine at Mahatma Gandhi Medical College and Research Institute. He is an assistant professor in Department of Pulmonary Medicine at Government Hospital of Thoracic Medicine, Tambram, and is an assistant professor in Department of Pulmonary Medicine at Stanley Medical College, Chennai. He is a visiting consultant at MGM Healthcare, Amjikarai, and at Dr. V. Balaji, Dr. V. Seshai Diabetes Care Hospital. I once again welcome you and hand this session to you for an enchanting and spellbinding session on what more steps we can take on our health as well as our hygiene, sir. Once again, I welcome you and hand this session to you, sir.
Hello. At the outset, I'd like to college and youth Red Cross and Mr. Bhuneshwar for giving this opportunity. Thank you, Sindhuja Madam, for that wonderful, excellent talk. 2020 vision has been very clear with your presentation. Moving on to what is this COVID, not going to tell what it's all about because for past 5 months we are all been in this pandemic situation. Let's put a bit simple, crispy, okay, and few points. What I'll say calls a sixer. It's a sixers. How it stands for P. So first P stands is not panic. Panic is the thing that what we look when we see most patients getting admitted or what. Okay. This COVID is very severe as what is predicted in the media. No, the COVID is not as severe as is predicted in the media because 80 to 90% of this presentation or asymptomatic or mild symptoms. Only less than 10% or becomes bit severe, and only less than 2% becomes very critical. Okay. Our Indian data also shows the same. Only less than 2% of people goes into critical condition. Okay. Next, what should we do as a precautionary measures? As everyone aware, precautionary measures is SMS. You have to have sanitize yourself, cover your mask, okay, and maintain social distancing. So social distancing is nothing but either you make 6 feet or 2 meter distance. Okay. What other thing is most common for young generation who is doing in the fitness. Most frequently asked is regarding exercise and mask. Sir, can we wear mask during our exercise, or should we wear mask during our jogging? I will recommend it that avoid mask at least when you can able to make a good social distancing, okay, and when this is crowded area or with minimum crowded area, okay. Don't try to wear mask and do all exercise. Sometimes lead to fatigue and headache and suffocation, okay. So if we need to do an exercise, need to do a jog, okay, then make sure that you do when there's very less number of people around you, okay. And second thing is prevention. The very important aspect is because the lot of people who get admitted are older people, age of 60, but these people gives a symptom that not been exposed to outer world for past 3 to 4 months, but still they get infected with COVID. How? Because as I said, that 80 to 90% of people are asymptomatic or mild symptoms. These people who fails to maintain social distancing get them to spread those infection to the elderly people in their house. So my sincere request to all will be is to prevent elderly people above 60 years of age. Make sure they don't go out of house until unless it is necessary, and people with comorbid condition. What is this comorbid condition? Patient with known heart disease, asthmatic, a patient known with kidney disease, or who is having BP or uncontrolled diabetes. Okay, such patient should be even more preventive measures should be given to those people also, and utmost care should be provided in preventing from this pandemic crisis. Okay. Next, what is this called as post-COVID effect? See, what happens when people after 14 days of infection, people comes home. It is important for all those who have been affected with COVID. It is that these people tend to start the routine life the next day. It is not as advisable to completely begin your regular activities. Okay. There is some kind of fatigue and tiredness which has been reported in most journals and most articles So post-COVID effect, what we call this post-COVID effect, where lot of people start developing fatigue and tiredness, and it is seen in more people who start getting themselves aggressive after once they finish the 14 days of COVID treatment. Okay, most of these patients should be advised to take some rest or limit their regular activities until they are comfortable with their healthy lifestyle changes or new lifestyle changes. Okay, and more important, when to identify all this. So when to identify, patient will have cough, cold, fever, headache, and importantly diarrhea. See, we can't ignore diarrhea in this pandemic crisis because diarrhea is also one of the symptoms of this COVID-19, and loss of smell and loss of taste. What should be done immediately? Okay, immediately go visit your nearby PHC or private labs. Okay, order, get a certificate or get a prescription from your doctor if he suspect strongly, or if you suspect strongly, or you had a history of contact or exposure to COVID-19 and you still have symptoms. Okay, then go get yourself test done at any government institution. Okay, once tests are done, once if it's positive, you no need to panic. Okay, this ultimately, okay, this is a self-limiting disease, and as I said, 80 to 90% of people are mild and asymptomatic cases. Okay, and once your test done, and if you are asymptomatic or mild, they advise you for home quarantine. And if you have other comorbid condition or elderly people, they advise you for administration for further evaluation and management. Okay. The most important thing that I want to bring to the audience right now is make sure you wash your hands frequently. Avoid touching your nose, eyes, mouth. Make good social distancing and use hand hygiene therapy. Last but not least, do not panic this pandemic region. One thing I like to say to everyone here, doctors, policemen, housekeeping are not only the COVID warriors. It is a 130 billion population is all a COVID warriors, because when each and every individual takes the responsibility to protect, prevent this society, I think we will soon and sooner will become an COVID-free era. I request all to completely make sure that you follow all the preventive measures as per the guidelines, and when you feel there's any symptoms, go get to a doctor, get a prescription. If you suspect you feel, do a test. Do not panic if you are COVID positive. Okay. Thank you, madam.
Sir, thank you so much. The session was an eye-opener to make us more cautious on our health and on our hygiene. Once again, thank you, sir. And now I hand over the session to Ms. Ebitra for the vote of thanks.
Yes, ma'am. Thank you, ma'am. Good evening to all. The best and beautiful things in the world cannot be seen or even touched. They must be felt by heart. Thank you is one prayer among them. I consider it a great honor and privilege to propose the vote of thanks on this occasion. Let me first of all start by giving glory to the Almighty God for making today's occasion a resounding success. My words are not enough to express my gratitude on behalf of our college. I would like to thank our chief guest who graced us with their presence, Dr. Sindhuja ma'am and Dr. Roshan Kumar sir, who despite their busy schedule and has found time to grace this occasion. Also express my heartfelt thanks to them for their valuable contribution. Also, I would like to thank those who worked hard in organizing this prepared event in a successful manner. And I thank all the distinguished invitees, staff members, researchers, faculties, parents, and my beloved friends present here accepting our invitation. Once again, I thank everybody for your cooperation in making the online awareness program in a resounding success. Thank you. Thank you so much.